Hello, hello. It is so hard to believe that we have arrived at this moment. It has been a fantastic week. I am so glad you are all able to join us for this week. This morning we heard the phrase, "Nothing thrives alone," and I think that this conference is sort of testament of that, how we all need each other and how we are part of this global community. And just as one other example, literally 5 minutes ago, I was presented with this. This is the Korean translation of the Planetary Health textbook. So this is joining the family of translations of the textbook just to show how we all come together as a community. So today we are gathered here now for our final closing ceremony. We will hear from a few new voices that you haven't heard from yet. We'll share a few reflections. We'll have a few thank yous, even though there are many thank yous we could have. There'll be a little bit of art, and towards the end, there will be the very exciting announcement. I know you have all been waiting with bated breath and trying to sneak the answer out of us, but we will make an announcement about the next PHAM who will host that, so please stick around till the end so that you can have that big reveal. But with that, I want to get us started with our first speaker, who will be joining us by video. Many of you know Paul Polman. He is the former CEO of Unilever, and he's a business leader, investor, and philanthropist.
Well, hello everyone. It's a great privilege to join you for the closing of this 10th Planetary Health Annual Meeting. My thanks, first of all, to the Planetary Health Alliance and to Erasmus University, and to all of you who have contributed your energy and wisdom to this important gathering. And a special acknowledgement to the Rockefeller Foundation, on whose board I actually sit. Their foresight and commitment helped launch this movement about a decade ago, and whose continued support, I believe, is essential today. This is a milestone moment, not only to celebrate how far we've actually come in building the field of planetary health, but also to recognize the urgent work that still lies ahead of us. Because let's be clear, the planetary crisis is not an abstract challenge happening in a too distant future or in faraway places. It is here, it is now, and it is human. The breakdown of natural systems is fueling a full-scale health and humanitarian crisis. And when we cross planetary boundaries, we know that people will suffer. Land degradation and biodiversity loss make pandemics and vector-borne diseases more likely. Plastic and chemical pollution are driving development delays, cancers, and mental health challenges. Rising heat waves are killing thousands from India to Europe and beyond. What is at stake here is not only forests, oceans, or species, but our bodies, our health, our dignity, and yes, our shared future. And yet, what this event has shown is that hope is not only possible, it's already here. The planetary framework has matured into a unifying force, bridging science and medicine, law and policy, business and civil society, youth and indigenous communities. No matter your vocation or your geography, there is a role for you in this work. The launch of Malaysia's National Planetary Health Action Plan is a remarkable step forward. It's the first time an entire country has actually embraced planetary health as a guiding framework for national development. It actually proves that governments can integrate health, environment, energy, and values into one coherent strategy. It should inspire, hopefully, many others to follow. We also saw how planetary boundaries and planetary health are now being woven together. Johan Rockström, Sam Myers, and many others have helped show that what we measure, we can also treasure. It was great to see the planetary health and planetary guardians actually coming together in New York during UNGA Week. Monitoring both natural systems and human health together is the bedrock of resilience. And new frontiers are opening. Planetary health law, governance, and urban design. When we embed these principles into courts, into city planning, into financial institutions, we actually move from theory to practice, from vision to scale. These are not isolated projects. They are the seeds of systemic change. And this, to me, is what net positive leadership is all about. Not only doing less harm, but actively restoring, regenerating, and creating the conditions for life and livelihoods to thrive. Building resilience, improving health, and giving more than we take. But let's also be honest. Knowledge alone is not enough. The challenge we face is not a lack of data. It is, in my opinion, a lack of courage. Too many leaders continue to cling to outdated yardsticks like GDP growth, quarterly earnings, narrow measures of success that ignore the real costs of ecological breakdown and human suffering. What we need is nothing less than a new operating system for leadership, one that recognizes the inseparability of human and planetary health. One that rewards justice, regeneration, and long-term well-being over short-term extraction. This meeting, in my opinion, has made clear that what we already know, what works. Decarbonizing our energy systems reduces emission and saves millions of lives from air pollution. Restoring nature improves physical and mental health. Enhancing nutrition cools cities and builds resilience against extreme weather. Investing in people, enabling households to adopt clean technologies, to restore ecosystems, and to eat more sustainable diets, delivers cascading benefits like lower costs, stronger communities, and better health outcomes. This is not idealism, it is practical policy. The real question, to me, is whether we have the courage and imagination to act at the speed and scale that science and justice demands. The next decade must be one of acceleration. We need more national action plans following Malaysia's lead. We need planetary health embedded in legal frameworks, financial systems, and educational curriculum. We need to mainstream planetary health across the private sector, mobilizing investment and innovation. And we need stronger alliances between planetary boundaries, the Global Commons Alliance, the Wellbeing Economy Alliance, and many more. Above all, we need to reach new audiences and decision makers. Planetary health must become central not only to science and health communities, but to finance ministers, CEOs, mayors, educators, and yes, young people everywhere. So, as we close this 10th annual meeting, let us not simply reflect, but resolve. Resolve to make planetary health the foundation of our work over the next decade. Resolve to hold ourselves accountable for scaling solutions, for challenging updated systems, and for acting with urgency and with hope. The world does not need more reports gathering dust. It needs leaders in every sector, in every society's parts, who are willing to take responsibility, to collaborate courageously, and to deliver a future that is healthier, more hopeful, more just, and truly net positive for all life on Earth. I want to thank you and congratulate you on this important milestone, and hope to see many of you in the not too distant future. Thank you very much.
So very inspirational video, but we go back now to the claim of our meeting that was urgency and agency for system change. So the need for implementing solutions, the solutions that are at the core of the planetary health definition. And we took for serious this at the Erasmus University here in Rotterdam, because if you can probably remember that the Rector Magnificus during the opening ceremony mentioned that we were about to launch the planetary health diet implementation at our school. So that's why I'm very pleased to have our Erasmus University Rotterdam Policy Advisor Sustainability, Annemiek Strijker, here with us. And that talking about the convening that we just had yesterday, launching this great initiative. Thank you, Annemiek.
Thank you all for having me here. As a policy advisor, this is quite special for me. Yes, so as a university, it's not only about contributing to the global dialogue on planetary health, but we're also taking concrete action to bring these principles to life in our own organization. And a key example is the Planetary Health Diet, the adaptation from Eat Lancet, which we are now implementing on our campus. A few years ago, Erasmus University set an ambitious goal to become a fully vegan campus in 2030, but as we engaged in dialogue with our students, staff, and our food partners, we learned that this approach unfortunately lacked a broad support. And while the intention was appreciated, many felt it did not allow for cultural diversity, for flexibility and inclusivity. So this conversation led to a more balanced and especially a science-based approach, the Planetary Health Diet, which maintains our strong sustainable ambitions while respecting freedom of choice and also diversity. It's both a scientific framework and for us a social process grounded in co-creation with our community. So as our university, we recognize that our responsibility goes beyond the educational research, and we also must lead by example in our daily operations. So that's where I come in. Click. So yesterday, October 9th, we signed a covenant with all our entrepreneurs, all food and beverage partners on campus, together with the Vice President, Ellen van Schoten from our university. And together with our entrepreneurs, we have now committed to 3 measurable goals. 80% plant-based food based on procurement, at least 50% plant-based menu offerings, and at least a 50% reduction of CO2 emissions from food and beverage services compared to 2025. And these targets weren't imposed from above. They were co-created with the people who make and serve the food every day. And to guide this transition, we developed a food and catering roadmap from 2025 to 2030, and this year has been all about engagement. We've been listening, learning, and especially also have been building trust together with our entrepreneurs on campus. And yesterday, the milestone was the official signing of the covenant on the Planetary Health Diet. Thank you. And the covenant marks a shared commitment between the university, the partners on campus, and it also symbolizes how global principles of the planetary health are being translated into local and tangible action on our own campus and with our own community. The entrepreneurs will continue to meet regularly to share insights and test new ideas, because meaningful change doesn't happen through policy alone. It happens through collaboration, daily practice, and collective learning. In this way, the Planetary Health Diet becomes more than a framework. It becomes a living practice and shaping how thousands of students and staff make sustainable choices every day. And with that, we're also collaborating with our faculties, with Chiara, and many other researchers on campus to share knowledge, invest in ideas, and make each other stronger with this commitment. Because at the university, we believe that the transformation towards the planetary health begins close to home. By transforming the way we eat, we contribute together to a healthier people and a healthier plate and planet. Thank you so much for being here.
So thank you for sharing this initiative. That is not the only one present and advancing at Erasmus University. If I can have the purple set of slides, please. Not this one, the purple one that you were sharing before. Sorry, technical issues at the end, at the closing. Okay, thank you. So this is another important initiative that is not running yet, actually, but will be announced today and then officially announced also in May, we will see, and that's regarding particularly our School of Health Policy and Management. The Planetary Health Initiative at the Erasmus School of Health Policy and Management is located at campus Wodestein, which is on the other side of the city, where in the city center we are located with our main Erasmus University campus in the eastern part of Rotterdam. And this is our shared vision, so a vision that is really located in a world where humans live a healthy life in harmony with ecosystems. And this is a message that we continuously heard during this day at PHAM 2025. So it's particularly important also for us and in our school. The health of the planet, communities, and individuals, we know that is protective only if we achieve innovative, equitable, and evidence-based solutions. And this is really what we would like to advance within our group. And to advance this vision, indeed, the commission that commits our initiative is to leverage transdisciplinary research, education, but also policy engagement to inform the decision-making, but also to develop and implement evidence-based policies and management strategies that promote human health and well-being, but also social justice, while protecting and restoring the 9 planetary boundaries, as we have heard during the first day of this event. We have 4 core values that are the collaboration, first of all, and this is something that we would like also to achieve with you and to stay in touch, of course, so not stop this collaboration only with this event, with PHAM 25, but to continue to be in touch with you. The solution orientation, as the planetary health definition is, of course, highlighting. The transdisciplinarity as well, but also, finally, equity and justice. We have 3 strategic objectives. We are an academic institution, so we belong to an academic institution, so of course research and education are pillars for us, but we don't want to do these activities also because of the importance related to the scientific community, but really to have a societal impact, so to really achieve the system change that is also so important in general for planetary health. As I was mentioning at the beginning, this is just a bite of what we will be doing, because the official launch of our initiative that we are still working on will be the World Biodiversity Day 2026, so 22nd of May, next 22nd of May. So stay tuned. How to stay tuned? We suggest to follow our Erasmus School of Health Policy and Management page, so you can scan the QR code that is showed here, or look for ESHPM on LinkedIn, and through, of course, all our email addresses if you prefer. But this is not only my work, so I'm very pleased to share this stage with all the team that is part of this Planetary Health Initiative. So please. This was not the thank you for the PHAM. That's different. This is the ESHPM initiative. Okay. I don't know if we are ready with the Okay, now we are ready to move back a bit with the second guest for this closing ceremony. And it's my pleasure to introduce Casimiro Vizzini, who's a medical doctor with a long career with UNESCO's natural science sector and currently senior manager for health at the Africa Europe Foundation.
Good afternoon. It's a genuine pleasure to introduce someone I have had the privilege of working closely with and deeply admire, Dr. Lidia Brito, UNESCO's Assistant Director General for Natural Sciences. Born and educated in Mozambique, Lidia trained as a forestry engineer and earned both a master and a doctorate in forest and wood science from Colorado State University. She returned home to serve on the faculty of Eduardo Mondlane University, heading the forestry department and later becoming vice rector for academic affairs. She then made history as Mozambique's first ministers of higher education, science and technology. Dr. Brito joined UNESCO in 2009 and led the organization's Science Policy and Sustainable Development Division. In 2014, she moved to Montevideo to become director of UNESCO's Regional Office for Science in Latin America and the Caribbean, overseeing initiatives that linked research with sustainable development across the region. In 2022, she took over the multisectoral regional office for Southern Africa in Harare, culminating in her appointment as Assistant Director General in 2023. This trajectory from national minister to regional director to global science leader speaks volumes about her ability to bridge science, policy, and society. But titles alone don't capture why Lidia is the perfect person to close this conference. She pairs intellectual rigor with genuine openness and curiosity, living her belief that science is not only a technical exercise, it is a cultural and social endeavor. Her empathy turns routine meetings into lively exchanges about values and ideas, and her inclusive vision makes her not just a distinguished scientist, but a trusted guide for the journey ahead. So when we ask who better to address the closing remarks of the Planetary Health Alliance Annual Meeting 2025, the answer is obvious. Please join me in warmly welcoming Dr. Lidia Brito, a fitting finale to a Congress dedicated to health of our planet.
Thank you very much, Casimiro. I couldn't have a better introduction, and apologies. I'm a little bit late. I had something that was unexpected, but really great to have the chance to give you some words. Excellencies, dear colleagues, dear friends, it is a privilege to close this inspiring annual meeting of the Planetary Health Alliance, held under the patronage of UNESCO. Let me first thank our hosts here in Rotterdam and all of you for the energy, knowledge, creativity who have marked these days. For UNESCO, this moment carries deep meaning. Already in 1968, at the Intergovernmental Conference on the Biosphere in Paris, UNESCO was the first intergovernmental organization to affirm that human health is inseparable from the dynamics of the biosphere. That recognition, which may have seemed visionary at the time, led the foundation for the Man and Biosphere program that today is almost 800 biospheres as part of the World Network. And these biospheres are in 142 countries, and they cover all ecosystems that we have in Earth and also all climate zones. So they are very important sites to really serve as a global laboratory where science, policy, and community life comes together in pursuit of a healthier relationship between people and nature. The Planetary Health Alliance embodies the same spirit. What we have seen here in Rotterdam is a powerful demonstration of working together. Planetary health requires cooperation, and here we see scientists and practitioners from across disciplines and continents, students and early career leaders, policymakers, artists and communities all working together. This diversity is not a side element. It is the essence of planetary health. It shows us that science is not only a technical exercise, it is also a cultural and social endeavor, deeply rooted in our shared humanity. Some of you may know that UNESCO hosts the Technical Support Unit on Indigenous and Local Knowledge for the Intergovernmental Platform on Biodiversity and Ecosystem Services, known as IPBES. The 2024 thematic assessment on the interlinkages among biodiversity, water, food, and health, the Nexus assessment, offers a comprehensive synthesis of how these systems are interconnected and mutually influential. IPBES reinforced the message that you have emphasized here. It advocates for integrated cross-sectorial governance that avoids siloed decisions. It identifies response options, many of them low-cost and nature-based, that can deliver co-benefits across the nexus. These include agroecology, ecological intensification, and integrated aquaculture. Each of these approaches promotes resilience, equity, and sustainability when tailored to local contexts. UNESCO is committed to bringing multiple knowledge systems together to help deliver solutions now and for the future. This is also why UNESCO is proud to be at your side. Our mission is to strengthen the connections between science, policy, and society. Through science diplomacy, we build bridges where political divides might otherwise prevail. Through open science, we ensure that knowledge is shared equitably, accessible to all, and co-created with communities. The Planetary Health Alliance is a natural partner in this work. By bringing together such a vibrant and global network, you are already practicing science diplomacy. By committing to publish and disseminate your outcomes openly, you are making open science a reality. By integrating arts and creativity in your program, you are reminding us that knowledge must also touch arts if it is to change systems. As we look ahead to the 2027, the urgency of our task is undeniable. Climate change, biodiversity loss, pollution, and emerging health risks continues to accelerate. But the urgency is also here in this community and in the partnership that have taken shape in Rotterdam. If we harness the momentum of this meeting, align our strength, and carry planetary health into policies, institutions, and local realities, then we can make real progress towards systemic changes. Let us therefore leave this meeting with a shared commitment to keep planetary health at the center of global conversations, to strengthen the science policy interface, to expand open and inclusive science, and to use diplomacy to ensure that no region or community is left behind. Colleagues, dear friends, the journey from agency to agency depends on us. UNESCO is proud to walk it with you, together with the Planetary Health Alliance. May the inspiration we have found here in Rotterdam guide us with courage and solidarity towards the transformation our world so urgently needs. And I thank you very much.
So thank you, Dr. Lidia Brito. The patronage from UNESCO to this Planetary Health Annual Meeting 2025 was something that really makes us proud of the connection and the several opportunities of collaboration that are indeed present, and you mentioned during your speech between UNESCO and the Planetary Health Alliance, and in general through these important institutions. So thank you very much for your attendance. We know that you are very busy, so we leave you to your other commitments. Thank you again. If we can have the set of slides that was shown before, now is the right time.
I also just want to take this moment. There's a rumor that some of my colleagues have started that there might be a conga line that I'm leading after this. It's just a rumor. They're just to dispel that right now.
Okay.
But we will be celebrating. So Chiara,
Yeah, sure.
Start the celebration.
Yeah, we would like to share with you some milestones and key features of this Planetary Health Annual Meeting 2025. So it will not be just a list of numbers, but we really want your involvement also to thank you what's behind, and you as part of this Planetary Health Annual Meeting, because we are here only because you are here in the public, and also the online participants that really make this happen. So starting from some milestones, some important numbers, we have all the continents represented in our attendance, and that not only makes us proud, but really underlines the importance of being a community, a global community of people working and involved in general in planetary health. As I mentioned during my opening speech, we are about, or even more, because we have very last-minute registration and on-site registration during these days, more than 400 attendees coming from all over the world. And we received more than 400, exactly 432, if I remember correctly, abstract during when the call for abstract remained open. So this demonstrates there is a lot of attention also for research in planetary health, but also practice, because we also received many project abstract among these 400. We also received a lot of interest through our website. There was an email address where just to receive information, a sort of newsletter, and we received over 700 of people who were interested, subscribed actually to our information regarding this PHAM. And finally, and you are well aware of this because we have a high participation in all the art activities, starting from the pre-conference that Devin held. Where is Devin? I don't see her. Probably she left. But many other, Noé, I don't know if he's in the public. Thank you very much for your, thank you for your performance, and many, many other art activities. So a round of applause for this. It's a bit of improvisation, this closing.
And as Chiara was mentioning, we are so excited by the representation we've had. We've had participants from over 50 countries. However, we do want to acknowledge that we had started this conference with really even higher aspirations, and the geopolitical context has led to various complications. I can't tell you how much we at the PHA team and the Erasmus team, our heart broke each time we heard that someone's visa was denied. We also know that the funding constraints were particularly harsh this year, and so that made it less accessible than we would have liked. And so I just want to say that even though we are so excited that we've had this participation, this commitment to global accessibility is real and it's deep, and we are looking forward to engaging with all of you and thinking through how we can ensure that all of our future encounters allow for this kind of connection and collaboration across the full community.
And we also have a very large digital community, because you're probably aware that we have a page on the PHA website where you probably already during these days consulting the WhatsApp group and many other opportunities to be digitally connected for this FAM, but also a LinkedIn group, that's the one here below, okay, that will stay open, okay, so we hope that you will share their photo or your impressions about this event and anything you would like to share through this kind of channel. And finally, also an Instagram account of our FAM where to share also pictures and all your feelings, feedback of this Planetary Health Annual Meeting. We also, this is about arts, unfortunately it's not very well showed, but it describes how the art activities took place during this event. So we had some paintings at the pre-conference, as I said, the film, the movie of the Brazilian director that was shown also during the second day. We had poetry with some poems that you probably heard if you attended the session, the parallel session where they were read. And there will be also a final surprise about it, I'm not revealing. And finally, dance, that was also very well then implemented and shown during our social dinner.
One of the other highlights was also the continuity from our last annual meeting. So if you joined us in Malaysia, you'll remember that at that meeting we launched the Planetary Health Roadmap and Action Plan, and actually Jamila handed it over to Chiara and said, please hold us accountable for actually making action on this action plan. And in the 18 months between then and now, there were 6 working groups working hard, and one of the things that was so exciting to me was to see us here and to have reports from those different groups and to hear not only about all the progress and what they've accomplished, but also all the things that are going to come next. So this is a step along this journey, but we know that there is more to come, and we know that there's momentum in this room and in our community to keep moving this forward.
And this is our photo, so really real time. Yeah. Abstract, more than 400, we said, and the best scoring ones will be published in a special issue of the Lancet Planetary Health to be published soon, and probably you attended also the lightning talks where these abstracts were described more in detail through presentations. But particularly for this activity, I would like to thank you, not only the scientific committee that we will be then read at the end of this presentation, but particularly two people that were involved in all the process of setting up the scientific committee, the abstract revision, the categories, and so on. Really, really a busy days that we had. And they are Gaia here and Sasha. I don't know if you're there. Please stand up.
We also have an exciting opportunity. There will be a special issue of Challenges Planetary Health. So we are inviting new submissions. If you are interested, you have time to still submit your abstract if you want to be included in this special issue.
And also don't forget, if you haven't done it yet, to fill in our survey, because we are trying to join research with this event. So we are interested in analyzing which is the carbon footprint of FAM 2025 with part of our Planetary Health Initiative at ESHPM. So please don't forget to scan the QR code and fill in the survey if not done yet. And if you follow us on our page, then on ESHPM, you will, of course, also be informed of our results.
And if you're in a survey-taking kind of mood, you shouldn't stop there. You can also, we invite you to take our evaluation survey. We need to hear from you so that we can make sure that future FAMs are a success. So please, we really welcome your open and candid feedback.
And probably you will go to artists tonight. So the conference, the event is not stopping here with this closing ceremony, because we will also have a post-event activity to the Artist Zoo. It's a night walk at this Amsterdam Royal Zoo, starting at 7:30 with a walk-in and with an official guide and explanation at 8. Registrations are full, correct? So you can only go if you already registered with your PHAM registration. And now it's the real moment for thank you, because we have a lot of people to thank, starting from the volunteers, and I would like you to stand up reading your name. So Alice, Alicia, Anastasia, Caroline, Corina, Corinna, Danny, Devin, Doris, Effie, Francesco, Habab, Giulide, Lorenza, Michela, Richard, Tinta, e Ferle. They were effortless. You've seen it during these days everywhere. So the biggest applause. And I would also like to thank other people at ESHPM that are not here today with us, but in the backstage. We're really helpful with visas, with booking hotels and everything for our travel scholars. So a lot of activities, as you can imagine, during the last 18 months. And they are Catherine, Eugene, Lisa, Marlou, and Mary. A special thank you to Orlag, who led the yoga and mindfulness activities, to all the Dulen team, to the Congress Bureau, and finally, I would like to thank the PHA team, starting from Jess, Marie, and Tassi, and our regularly bi-weekly meetings, where we were always smiling, even through the biggest challenges, and really not thinking that we would be here today with a room full of people until the last month, I think. So, yeah, really, thank you a lot. But all the rest of the PHA team, the communication, changing the slides 2 hours ago, even these slides, as you can see, with all the pictures, updated pictures coming from PHAM, the unofficial translator and conga line expert, Carlos. And Yelena, I'm not mentioning all of you, but really a heartfelt thank you from me.
And I want to add my thanks here too. One of the things that is so thrilling as a staff member to come here is also like you become part of another staff family. And so it has been such an honor and a delight. This is the part of the presentation where I get emotional. But it has been such an honor and a delight to get to know all of you and to work with you and to be part of your team. And I do want to have just a huge, huge thank you to everyone on the PHA team and our colleagues at the Johns Hopkins Institute for Planetary Health. You've done so much work for such a long time, and we are so grateful. And I have to have a huge, huge special shout out to Tulsi. I feel like we've been like attached at the hip for the last week or more, and so, but we would not be standing if you weren't here with us. So thank you, Tulsi.
Days and nights, nights and days with the different time zones. We only know how many emails we exchanged during these last 18 months. Thank you. And we would like to thank also our sponsors that supported us being here today. First of all, the Rockefeller Foundation, already mentioned also by Paul Polman, but also the Rotterdam Collaboration for Change, the Hat Park, the Association of Schools of Public Health in the European region, ASFER, Altem's Advisory, Rotterdam Partners, the Municipality of Rotterdam, and also the Stitching Erasmus Trust Funds. And we have also some knowledge partners, ESHPM, of course, but also the convergence with the PDPC, Pandemic Disaster and Preparedness Center, the TU Delft, the Erasmus Medical Center, the MVO that also supported us with the grant, the Resilient Delta, and finally the patronage from UNESCO, which is very important for us, as just heard.
We also want to extend our thank you to the Gordon and Betty Moore Foundation. They provided funding for our travel scholars, so they were able to join us from all different regions around the world and be part of this conference.
And the Arts Committee, that's the first time that a PHAM has an Arts Committee, and we hope it will stay for the next Planetary Health Annual Meetings from now on. You can see here all the people that were involved. I'm not mentioning each of them, but really big thank you, because they were those we developed all the arts activities that you've been enjoying during this PHAM. And then the local organizing committee, these people, but you can see that our bigger circle here, because that's the moment that you should be on the stage, because they also were involved nights and days for this PHAM with sickness, sore throats, everything, even sick during these last days. But it's really mostly thanks to them that everything was perfect during this Planetary Health Annual Meeting. So Doris, Perle, and Richard, please stand up. 3 fabulous PhDs that stopped their PhDs literally during the last 3-4 weeks because of the last efforts for this fund.
And then we have our scientific committee. As Chiara mentioned, we had a record-breaking number of abstracts, about 2.5 times as many as we've had before. So we needed many people to help us review them. I am not going to read all of these names, but we just want to share our deep gratitude for everyone who participated in that review process. And then finally, and I am going to invite Marie to join us on the stage, since I know that she will want to also join us in thanking our program committee. So these are the individuals who really had the inspiration, that had the vision, that came to life in this conference. So we have a deep appreciation to our program committee, many of whom are in the room. So if you are in the room and you want to stand, please, we welcome you to do so. We know some of you are in the room. But I also really want to take a moment to thank our 2 co-chairs, Chiara and Marie. So Chiara, you know, we start on this journey together, barely knowing each other, and now I feel like we intimately know each other after all of the hours and emails and calls, and it has been such a delight, and one of the things that I will treasure from this whole experience is that relationship that we've been able to build with you. And now here's the really hard part. And Marie, our other co-chair, as you know, Marie she would just, all of a sudden, she'd be like, wait, I have a thought about this session. Do you think we need to be doing this for the session? Just constantly thinking of what we could do to make sure that these sessions were as meaningful and as inclusive as we could. And so we are all here very appreciative of your work on the program committee, but I also do want to take this moment because we know that you've been stepped down into a different role to just start, I'm not even going to start, but to very briefly acknowledge just everything that you have done for the movement, just the joy and the heart that you have brought to Planetary Health and to all of us. And I could not be happier than to have been able to spend the last 18 months working with you. And I know the whole community feels the same, feels that, you know, that the Marie joy in their hearts whenever they get to spend time with you. So a warm thank you.
And I would like to echo Jess, that was real pleasure. And Maria always said to me when we had this meeting, you always look fresh, you always look fresh. But she was always smiling. I don't remember one single meeting without her smiling and enjoying. And also when I was desperate because of the challenges that we were mentioning before, she said to me, no, don't give up, always really, yeah. And we are here indeed, so thank you.
So I think that concludes the thank you portion of this, and then we'll have a few moments to sort of to recover ourselves while you all are able to enjoy a video celebrating the first 10 years of Planetary Health.
10 years ago, a holistic solutions framework emerged that is transforming how humanity addresses its greatest challenges. Scientists, indigenous leaders, health professionals, and people worldwide united around one profound truth. We cannot secure the health of people on an ailing planet. A groundbreaking, cross-disciplinary commission was formed, and in July 2015, it issued a defining report.
We called it Planetary Health, the health of human civilization and the state of the natural systems on which it depends.
The evidence was overwhelming and continues to mount. Climate change, biodiversity loss, pollution, and other global-scale environmental change weren't distant nor distinct environmental problems. They were immediate and future threats to human well-being. Every breath we take connects us to forest ecosystems. Every drop of water we drink links us to watersheds. Every meal connects us to soil health and biodiversity.
Our home is awe-inspiring and fragile, and that just as it nurtures us and all living things, it also requires our care.
In December 2015, the Planetary Health Alliance emerged, not as another organization, but as a catalyst for transformation. What began with one meeting at Harvard University became a global gathering every 18 months. From Cambridge to Edinburgh to Sao Paulo, from virtual connections during the pandemic to breakthrough moments in Malaysia, each meeting expanded our understanding and our community. From 12 founding institutions to over 500 organizations across 80 countries, and now a new secretariat home for the Alliance at Johns Hopkins University, this decade has proven that planetary health approaches work. Cross-sector collaboration is generating breakthrough solutions. Indigenous and local knowledge systems offer essential wisdom that reshapes how we think about our health, environment, and justice.
Our ancestors have always knew what science is now proving, that healing the planet is healing ourselves. Planetary health gives voice to wisdom we have carried for millennia.
When we brought the annual meeting of the Planetary Health Alliance to Southeast Asia for the first time in 2024, we were trying to send a very strong message. The Global South is ready to lead. We aren't just talking about global challenges. We want to do things. We want to have a clear action plan and roadmap. And we want to take global ideas, but we need to embody them to context and take action where we are, in our own countries, in our own communities, in our own region.
My generation doesn't see environment and health as separate issues. To us, they have always been one fight for our future.
Our alliance created the building blocks to foster a thriving and active global community by developing foundational resources and tools, from education materials, pledges and declarations, and policy briefs to regional hubs and a rich and resourceful online presence. In Kuala Lumpur, in 2024, a new chapter began. Under the theme, From Evidence to Action, Confronting Reality, the global community created something unprecedented, the first ever Planetary Health Roadmap and Action Plan.
For the first time, we had a unified compass, clear actions for governance, education, business engagement, measurement, and communication that anyone, anywhere could follow.
The evidence of transformation is everywhere. Healthcare systems cutting emissions while improving patient outcomes. Cities designing for both human thriving and ecological resilience, as well as WHO's pandemic agreement and other global policy frameworks recognizing the interconnectedness of the Earth system and human health. The numbers tell a story of momentum, but the real story lives in communities where people are breathing cleaner air, eating healthier food, and driving the transformative systemic change needed to stabilize our natural systems and secure improved health for all. This October, as we gather in Rotterdam for our next annual meeting, we face a choice. We have the roadmap, we have the community, and we have the science. The question isn't whether transformation is possible, it's whether we'll act with the speed and scale this moment demands. This is everyone's moment. Health professionals, earth system scientists, policymakers, communities, funders, governments, private sector representatives, and especially youth. 10 years ago, planetary health was an idea. Today, it's a movement. Tomorrow, it must be how we live. The health of all life on Earth depends on what we do next. Join us, and with hope for a better tomorrow, take action.
So in case you were wondering, Marie assures us that she's not leaving us to pursue a career as a professional voice artist, actor, but I think after that performance, she does have, a real career out there if she wants to continue to narrate films or lead conga lines. All right. It is now my pleasure to invite Rachel to the stage, who is going to make a big announcement.
Partially make a big announcement. Thanks so much to everybody. Thank you to everyone who worked on that video. The video is, I think, amazing, and it's a beautiful representation of all the work that has happened, but is also really inspirational as we look to the future. And on that note, part of what everyone has been wondering is, where will we be for the next PHAM in 2027? And so I am so pleased to invite to join me on the stage two colleagues to help announce the location. Keiko Nakamura is a professor at the Institute of Science Tokyo. She also serves as the head of the Secretariat of the Alliance for Healthy Cities and the director of WHO Collaborating Center for Healthy Cities and Urban Policy Research. And Saori Kashima has been an active member of the Planetary Health Japan Hub and the newly forming East Asia Regional Hub. She's an associate professor at the Center for Planetary Health at Hiroshima University. And since 2022, she has been acting as the director of the Center for Planetary Health and Innovation Science at the IDC Institute. So, without further ado,
okay, so thank you so much, Rachel. And also, first of all, I would like to express our sincere gratitude to Chiara, your wonderful meeting. Thank you so much. And also Marie, and also Rachel, and also Sam, so somewhere. Yeah, and then so also we would like to say thank you to all staff members of the Alliance. Yeah, and also the volunteer staff members. So we truly enjoyed the whole program of this wonderful meeting. And also we had a great conversation with all our colleagues through these inspiring days. And also this very memorial closing ceremony, I'm almost crying. Yeah, and then so it's a great honor to announce that the next Planetary Health Alliance annual meeting will be held in Tokyo, Japan, in 2027. Thank you. Yeah, thank you so much. And then so our lead of the Japan Hub, so Professor Chiho Watanabe, he want to share the welcome message to you. So can you start the video?
Good afternoon, everyone. I'm Chiho Watanabe, speaking on behalf of the Japan Hub Planetary Health Alliance. It is a great honor and a pleasure to host this very important meeting in 2027 in Japan. We'd like to express our sincere thanks to everyone, particularly Sam, Mary, Rachel, also Hannah, in the Alliance for your generous support. Please excuse me that I cannot be there in person, but I believe colleagues of the Japan Hub would convey our warm welcome to all of you The annual meeting in Rotterdam shows that planetary health is rapidly moving forward across the world, even in a relatively short period of 18 months after Kuala Lumpur. Europe and Malaysia are among head starters, I think. At the same time, we also learned that the fragile and unstable atmosphere of our planet, in many senses, may be taken as a risk for planetary health, but could be a trigger for new thinking and great transitions. It is not easy to predict the progress of the planetary health in next 1 or 2 years, but we will try to make a platform where further progress of the planetary health across the world can be shared and discussed. As we have announced in the regional hub session on day 1, we have just launched the East Asia Hub of the Alliance, which is composed of 6 communities in this region. So, in cooperation with these hub members, Japan Hub would do our best to make a meaningful and enjoyable meeting in 2027. So I hope many of you in this room would come to Tokyo together with your colleagues. See you in Tokyo in 2027.
Thank you. And also, we have a short introduction video of the metropolitan area of Tokyo. So could you start the next second video?
Thank you very much, and I see you all in Tokyo.
Thank you so much. I hope we see everybody in Tokyo. And now before we close, I want to invite to the stage, and we're going to need to share a microphone, 4 of our travel scholars who are going to help us read a final poem. So please welcome to the stage Agan Leonard, Amira Puji Hastuti, Aman Tawer, and Kuzipa Nantanga. Please come on up. Thank you.
Hello everyone, so we're gonna read a poem written by Zia for the Art from Scrap from Planetary Health Club. This is a great call to action, for we have been asleep for centuries and our world now threatens to come down in ruins. Will you answer? Or will continue to drool in your slumber? She yearns for attention and warns us to tread with caution. There's only so much dirt she can take. She has sustained us for years. And now is the time for us to wipe her tears. Time to undo our mistakes. Time to take note of what is at stake. Time to build and maintain an environment that sustains. Time to listen to Earth's complaints.
It has become our responsibility to give life to the dead and hope to the ones yet birthed, to make and not break the world that has nurtured us, to live life considering the coming ones. Every carton drop, every paper or plastic tossed, every waste mismanaged threatens the human existence. There are creative fingers waiting, brilliant minds thinking, sharp brains innovating. What are you doing? Will you not join hands to breathe life into waste? Will you not give hope to the generations unborn?
Will you wait until our planet crumbles before your very eyes? Do you not see how your actions kill us? How your negligence harms us? 7 of the 9 planetary boundaries have been crossed. Think. Think of the frequent natural disasters. Think of how much we have lost. Think of the strange diseases, COVID, Ebola, cholera. Think of how much we have lost. And like a thief in the night, the mental health of millions slips away. Plastics in our veins, our oceans polluted, acid rains, our planet remains unprotected.
Fast-flying fashion, I talk of trends that come and go, leaving heaps of clothes never to be worn again. And when asked, they say, I'm only just going with the flow. And so I ask, how do you live? Do you, because of abundance, waste resources? How do you eat? Do you, because of abundance, waste food and drink? Do you support nature or turn your back against it? On this cause, some have risen to form an alliance, so why won't you? Ladies and gentlemen, your presence here means that you have given Earth its well-deserved attention, and that you are ready for the great transition.
Thank you. It's time to close. Thank you so much.
We really meant it.
No, thank you, a heartfelt thank you, because we didn't expect that it could have gone this way because of the struggles and really about participation. We received so many visa denials really in the last few weeks. So we were really disappointed about it because we could be even more. And we know from the opening that inclusivity and accessibility to science in general, and particularly for planetary health, is so important. So being blocked somehow in this purpose from something that is above us, unfortunately, is more disappointing than ever. So yeah, just this, but I think we can close with the hope, because this demonstrates that change is possible. And it's just a matter of really being strong together and believe that we can really change. So I hope that this is the message that will bring you back to your home, to your countries, and hope to see you all in Tokyo, in Japan.